Welcome to The Explainer. Today, we are digging into something huge, public health, and we're going to break it all down using a really clear blueprint with HIV prevention as our case study.
So, what does it really take? I mean, you'd think it's just about, getting the information out there, right? But what if I told you that just throwing facts at people is actually one of the least effective things you can do? Yeah, the real answer is way more interesting.
See, it's not about some magic bullet solution. It's all about a blueprint, a really comprehensive one where every single piece has to fit together perfectly, from the highest levels of government all the way down to a one-on-one conversation in a community. All right, so what's in this blueprint? We're going to walk through it piece by piece. First up, getting support from the top. Then we'll talk about empowering the people. After that, we'll look at what a holistic plan actually involves. And finally, we'll tackle the biggest hurdle of all, fear and stigma. Okay, so section 1, a blueprint for prevention. And let's be clear, programs like this don't just spring up out of nowhere. They're the result of a ton of planning behind the scenes. So many different things have to be thought through. All right, section 2, support from the top. So where do you even begin with a blueprint this big? Well, you start with a foundation, and the absolute #1 non-negotiable foundation is getting support from the very top. Seriously, without it, the whole thing just crumbles. And I mean, it has to start here. We're talking about genuine political will. This isn't just a suggestion. It means you need a single national plan that gets everybody, and I mean everybody, from government to the private sector, on the exact same page, all backed by leaders who are visibly out front championing the cause. Okay, section 3, power to the people. So you've got that foundation of top-down support. That's crucial. But the real engine for change, that comes from the ground up, from the community itself. This is where things get really interesting. I mean, think about it. A country isn't just one big blob of people, right? It's made up of tons of different diverse communities. So a one-size-fits-all plan, it's just doomed from the start. And that's exactly why these partnerships are so critical. They let you build customized programs that actually speak to the people you're trying to reach.
Let me ask you something. Are you more likely to really listen to advice from a teacher or from your own friends? We all know the answer to that one. The data is super clear on this. Behavior change is way more likely to happen when it comes from your peers. It just creates a space where people feel safe enough to talk openly about tough subjects and, build new social norms together. And here's what's so cool about this idea. It's a total power shift. This isn't about some expert in a lab coat talking down to people. No. This is about putting knowledge and control directly into the hands of the community. When you learn from someone like you, the whole thing feels less scary, more relatable, and it works.
And this is maybe one of the most important parts. Who better to lead the charge for change than the people who have actually lived through it? The personal story of someone living with HIV, wow, that is an incredibly powerful tool. It moves people, it gets resources, and involving them from the start makes sure that these programs aren't just, well-intentioned ideas, but that they're actually relevant and meaningful to the people they're for.
Okay, let's move on to section 4, the holistic plan. So we've got the support from the top, we've got the power from the community. Now, what does the actual plan look like? Because it's not enough to just have good intentions. The design has to be smart, comprehensive, and really sensitive. This really shows you why you can't just focus on one single thing, like, say, condom distribution. It's not a checklist. It has to be a whole ecosystem of support, a full continuum of care, from counseling and education all the way to support and care services. It's a complete circle.
And this right here, this gets to the absolute core of good program design. Forget about a universal one-size-fits-all approach. It just doesn't work. To be effective, a plan has to be customized. It needs to be flexible and super sensitive to the local culture, the religion, the traditions. Otherwise, people just won't buy in. And being sensitive also means being practical about access. Look, if people feel embarrassed or judged for getting condoms, they just won't. Simple as that. So you have to think beyond the clinic. We're talking about putting them where people actually are. Factories, bars, college campuses, maybe even private self-service spots. Make it easy and embarrassment-free. Okay, our final section, section 5, fighting fear and stigma. And we have saved the biggest challenge for last, because the single greatest obstacle to any prevention program, it isn't a lack of money, it's not a lack of information, it is the incredibly destructive power of fear and stigma.
This quote from UNAIDS just nails it. A vicious circle. That's exactly what it is. Stigma is the #1 reason people are terrified to get tested, why they don't get treatment, why they don't talk about it. It just creates this spiral of fear that isolates people and completely sabotages every other piece of the blueprint we've just talked about.
You know, stigma doesn't just pop into existence. It's a progression. It starts with something that seems small, like a stereotype, an oversimplified belief. But that can easily harden into prejudice, which is a negative attitude. And when that attitude fuels negative actions, well, that's discrimination. And that's where the real damage happens. So how do you fight something this big? It takes a full court press from everyone. You need leaders to stand up and visibly, loudly challenge discrimination. You need laws that actually protect people's rights. You need to monitor for human rights violations. And, you guessed it, you absolutely need the people living with HIV to be at the center of the fight.
So let's pull it all together. The crucial takeaway is this. A successful program isn't just one of these things. It's the integration of all of them. It's top-down support meeting bottom-up community power, all wrapped in a plan that is holistic, sensitive, and actively fights stigma. None of these pieces work on their own. It's the whole blueprint or nothing.
And that leaves us with one final big question. We've just walked through a blueprint that works for tackling a massive global health crisis. So, think about it. How can we take these same principles, this idea of combining leadership, community power, and smart, sensitive design, and apply them to the other huge, complex challenges that our own communities are facing right now?